So as Dr. Devon mentioned, there are 4 different main types of curative therapy for sickle cell disease. There's HLA matched sibling, which is the same as full matched transplant. There's haploidentical, which is half matched transplant. And then there's gene therapy and gene editing. So next slide, please. So in this, you'll see the first 2 types of curative therapies that I'm going to mention. What the goal of with the transplant or type of curative therapy is for the stem cells, which are the seeds of the bone marrow, which makes normal red cells, to be corrected. So that instead of making sickled red cells, they make healthy red blood cells. And we get these stem cells either from the bone marrow, which is directly from the hip, as you can see in the top picture, or from the peripheral blood, which you can see in the bottom picture. And in these 2 types of curative therapy, the donor is a family member. So the donor and the patient are separate. Okay, next. So how do we decide whether to offer a matched sibling or full matched transplant versus a half matched transplant? So you can see all the way to the left, there's 6 different proteins or HLA proteins that doctors look at in patients and family members to decide what type of curative therapy to offer. So you can see that the patient has 3 blue HLA proteins and 3 pink HLA proteins. And the blue proteins the patient got from the father, and the pink proteins the patient got from the mother. And every time that father or mother has a child, there's 4 different options that are possible. So on I forgot I wasn't going to be able to use, but you can see that first sibling got the orange proteins from the father and the pink proteins from the mother. And when you compare sibling 1 to the patient, the pink proteins match, but the orange and the blue proteins don't match. So this sibling would be considered a 50% match, a half match, or a haploidentical match. The second sibling 2 has yellow proteins from the mother and orange proteins from the father, which are completely different from the patient. So this sibling is a complete mismatch, so a 0% match. And then the third sibling has the blue proteins from the father, the yellow from the mother, and those blue proteins match the patient. So that sibling is also a half match or a haploidentical match. And then all the way to the right, you can see sibling 4 is a complete HLA match or 100% match. So the blue proteins and the pink proteins match the sibling and the patient. So as you can see, the more children this couple has, the higher the chance is that they will have a matched sibling. And you can also see that patient, as I said, is a half match to the father and a half match to the mother. So if the sibling is a half match, we'd be offered haploidentical transplant. And if the sibling is a complete match or HLA match, they can undergo HLA match sibling transplant. Okay, next. With the last 2 options, gene therapy and gene editing, the stem cells are taken from the patient and then they're processed and then they're given back to the patient. So the patient serves as their own donor. Okay, next slide. So you can see at the top that represents gene therapy. So patients have a sickle gene, and that's why their stem cells are programmed to create sickled cells. But what we do with gene therapy is the cells are given a normal gene. So that viral vector is actually the transport mechanism that's used for the normal gene to get inside the stem cells. So with gene therapy, a normal gene is inserted into the stem cell, and then the stem cell can make those normal healthy red cells. And then with gene editing, the difference is that CRISPR-Cas or some other approach is used to actually correct the sickle gene. So rather than putting a normal gene in like you do with gene therapy, you actually correct the sickle gene so that those stem cells are reprogrammed in order to make normal healthy red blood cells. So those are the 4 types of curative therapies that can be offered to patients with sickle cell disease.